response from each of you, but I'm sure you'll be able to elaborate after that. And we begin with Max Lynn. Do you believe that health care is a human right, yes or no?
Yes, healthcare is very important. That's why on my platform I do a hybrid system, which is a combination of government, so people are not left out. Under no condition should people lose their home or their savings over healthcare. No question about it. But you can't just go universal healthcare because it already takes a bankrupt nation and bankrupts it more. And also, we talk about political reform. I find it almost hysterical to sit here and watch Susan and Sarah say political financial reform when they are the heart of the problem. Maine has a chance to send a message, and we can do it with a vote for an independent candidate.
Lisa Savage, back to healthcare. The question: do you believe healthcare is a human right?
Yes, definitely. I don't think the words for profit and healthcare belong in the same sentence together. Not every human activity is appropriate for profit. Healthcare should not have been turned into a commodity. That's why our healthcare in this country is vastly more expensive than it is around the world, because it's the profit motive is in there. So I definitely want to move in the direction of a Medicare for all, an improved Medicare for all that covers mental health, dental, vision, hearing, and that people can count on, and that they don't have to worry about going bankrupt. Most bankruptcies are caused by medical bills, and most of those people had for-profit health insurance. So,
Senator Collins, is health care a human right?
Yes, it is. And there's so much that we could do to expand healthcare coverage and lower the cost, and lowering the cost is really key. There are several actions we can take. One is to have much more transparency in the system. That is so important so that people can compare prices. There's nothing more opaque than the cost of healthcare. Second, we can lower the cost of prescription drugs. I've already written 2 laws that are helping to do just that, but there's much more that can be done, such as putting a cap on the out-of-pocket costs for seniors under the Medicare Part D program. We also have to work on accessibility. After all, if you live in an area of the state where there are not a lot of healthcare providers, we need access to more telemedicine, and we need to preserve our rural hospitals. And that's where Sarah's plan really worries me, because I believe, based on a study that I've seen, that 15 out of our 36 hospitals would go under her public option plan.
All right, thank you, Senator. And Speaker Gideon, is health care a human right?
Thank you, Pat. Healthcare is a human right. You know, just last week, I was speaking to a woman from Litchfield. She's 59 years old. She had just lost her job and her health care. And she was crying because she was scared. And she is scared because right now, Republicans are trying to take our health care away, even during the course of a pandemic. It's something that Mitch McConnell has been determined to do for the last 4 years, and that Susan Collins has helped him do with her vote on the tax bill. Now in Maine, we made sure that we protected those same people who are put at risk with pre-existing conditions. And in the Senate, you can be sure that I will lead on this issue. I believe we need to create a public option that allows anybody to buy into Medicare who wants to do it, but also that allows Medicare to do things that the federal government should be able to do, like negotiate directly with pharmaceutical companies to lower the cost of prescription drugs. But the last thought I want to leave people with is this: there is no plan from these Senate Republicans who have been determined to overturn the Affordable Care Act. There is, by Senator Collins' own admission, no plan to replace it. We cannot afford to reelect Susan Collins or Mitch McConnell as majority leader.
Pat?
Yes, Senator.
If I may.
Go ahead. Yes. We'll hear from Lisa after that.
Okay. Pat, I was the first Republican to speak out against repeal of the Affordable Care Act. And it was I who cast the deciding vote to save it. So what Sarah said is just not accurate. And I don't know anyone in the Senate who is not for protecting people with pre-existing conditions. That's an issue that I worked on long ago, before Sarah even moved to the state of Maine.
I want to hear Lisa Savage weigh in on this too again.
Yes, I feel that talking about things like transparency and costs of healthcare or adding a public option to the Unaffordable Care Act is avoiding the issue. What we're talking about is the fact that people can't afford healthcare. I would also like to note that if we had universal healthcare in the form of Medicare for all, this would be a great boon to our business community, both small businesses and big corporations. This would help our economy if we could get our healthcare on the footing that the rest of the world is on.
We want to shift gears for a minute.